Another one of our top stories, India has locked horns with the WHO over its methodology of calculating COVID death toll and claimed that different yardsticks are being applied for different countries. India's reaction follows an NYT report which claimed that India is trying to stall a WHO report on global COVID death toll. As per the New York Times article, WHO claims 15 million people have died of COVID globally, which is double the official global death toll which has been given by the individual countries. Now, the New York Times article also says the WHO estimates that the third of the excess 9 million deaths which they have calculated has come from India. Among its objections raised, India has said that the same methodology cannot be used for smaller countries and for a country with 1 billion people like India. So there are several concerns which have been raised by India as far as WHO's method of calculating COVID death toll is concerned. On this, I'm joined by Dr Sanjeev Bagai, chairperson of Nephron Clinic. Dr. Bagai, thank you so much for joining us. But what we are looking at over here is this dispute about COVID death toll. These objections which have been raised by India is on one side, of course, and we've seen this New York Times article report which has come out. But, there are some concerns which are being raised by the Indian government as to whether or not there should be one approach to calculating global, calculating COVID death tolls, because absolute figures apart, which somebody might cull by taking reports from ground, if there is a system or a calculation method which is being used, can the same format be applied for different countries? What would you as a medical expert say?
Good morning. So I think I will not take the WHO report seriously at all, because I think if at all anyone has failed the world in this entire pandemic lasting over 2.5 years, it's WHO, an organization which is still to get to grips with the initial investigation to the origin of it from China. We have no data from China. We have no data on the Chinese vaccines. Chinese vaccines were allowed with a very poor efficacy. WHO did not allow the Indian vaccines with a much better efficacy to come in, so on and so forth. I think this report is biased. It's unscientific. There is no collaborative effort as in a scientific basis across various countries. All countries cannot be treated alike. The important points here is that most of the countries, I would safely say almost 80% of the world's countries, don't have the health records which are digitalized. It's almost virtually impossible to get a near accurate figure. And these are publications which have come in Lancet, in New England Journal, in JAMA, in various international bodies, including the US universities, that underreporting or underestimating of COVID deaths is a global phenomenon. It is not only India-centric. In fact, there are reports which had come out in the last 2 years from within US, from Mexico, from Russia, from Africa, Latin America. And can you believe it? The cruelest joke on the world is that China has reported less than 5,000 deaths. I mean, this is ridiculous. So we need a more rational approach. I think in the initial phase, it's important that the tests which were available were not freely available. A lot of the individuals went underreported because they couldn't be tested. The RT-PCR itself has fallacies. It has only 67% at its peak, going up to 80% sensitivity. And the home testing now is almost 75% worldwide, is still not being reported and not being calculated under the radar. So there are limitations. There are limitations worldwide. In this global pandemic, to single out one country would be unfair. It is completely biased. And also, deaths are not actually counted as primary or secondary. There are a lot of other precipitating causes. And there are a lot of COVID-like illnesses, especially in children. So I think this report or this statement from WHO should be taken with a huge pinch of salt, in fact, buckets of salt. I will not take it seriously. I think India has done exceedingly well in this pandemic. I don't want people to forget the havoc which pandemic created worldwide in the first 12 to 18 months. And India has stood tall for two reasons. One is a dynamic leadership, straightforward leadership, scientific approach, and the Indian vaccines have saved, I dare say, more than 1 million lives.
Dr. Bagai, thank you so much for joining us with your views on this. This is, of course, a story that we are following where India has raised certain objections with the WHO's methodology of calculating COVID deaths. Meanwhile, as far as the COVID status in the country is concerned, India has reported over 1,000 COVID deaths in the last 24 hours, and a large part of those deaths are being reported I beg your pardon, 1,000 COVID cases over the last 24 hours, and a large part of those cases are being reported from the national capital. In fact, in the latest, Delhi has recorded 461 fresh COVID cases and 2 deaths, and the number of COVID cases in Delhi is 26% up since the day before. The COVID positivity rate in the national capital has also climbed up to 5.33%. In fact, amid rising cases of COVID in the national capital, another premier school of Delhi has reported a positive case. Springdale's Dholakwa has asked parents not to send their children to school on Monday after a child tested positive. Earlier, the Delhi government in its advisory asked the school authorities to inform the Department of Education about COVID cases reported in schools and asked them to close specific wings or classrooms wherever needed. With that, we'll slip into a short break. More news and updates on the other side. Stay tuned.